Hey everybody, so I'm going to talk today in this video about a pretty simple office procedure I do that's called injection snoroplasty. So what this is, so this treatment is for patients who snore, obviously, but not really for patients who have sleep apnea. So this is for sort of garden variety snoring without any stopping or pauses in breathing during sleep. So injection snoroplasty, the idea with it is basically what we're trying to do is stiffen the roof of the mouth or the palate. Because in a lot of patients, the main reason for snoring is vibration of the soft palate or the roof of the mouth. And that vibration makes the snoring sounds. So with injection snoroplasty, I'm able to go in and basically do a very targeted injection right into the back of the throat. So if you look into the back of your own mouth, you can see the uvula, which is the little guy that hangs down in the middle. So it's right above the base of that uvula is where we place this injection. So the injection is going to actually be pretty much pure alcohol. And what the alcohol is it's a sclerosing agent. So it causes sort of a targeted injury to that area. And as that little targeted injury heals and scar tissue forms, that area tends to kind of shrink and pull together and then stiffen at the same time. So it kind of pulls the palate, kind of shrinks everything in a little bit. And normally we see that the uvula that hangs down kind of gets pulled upward a little bit. And then likewise, the scar tissue that forms there sort of stiffens that area. So the goal is to kind of open the throat up a little bit more and then also make the soft palate not vibrate as much. So by doing that, we get an improvement in snoring. So this procedure, it's really simple to do in the office. We put some numbing spray back there first. And then when I do the injection, it's actually half alcohol and half lidocaine, which is another numbing medicine. So it kind of numbs as it goes in. And then afterwards, it is sore for about a week. But it's usually nothing awful. Certainly easier recovery than like a tonsillectomy would be. And I'd say the majority of patients with this do require probably 2 injections. These are spaced out about 2 months apart to get an optimal result. If you are someone who snores, particularly if you don't have sleep apnea, this may be a good option for you. One thing to keep in mind is that injection snoroplasty is not covered by insurance most of the time. And the reason is insurance doesn't consider snoring to be a medical necessity to treat. But if you have a spouse who's kicking you out of your bedroom, it may be a necessity for you. And you can certainly come into me and talk about options with this or other treatment for snoring. So anyway, I hope that's helpful for any snorers out there, and I'll see you guys back in the next video.